Welcome back, everyone. You are watching the Dr. Nandi Show. Thank you for staying with us. And today we're talking about hip, back, and shoulder injuries. Sometimes surgery should be the last option. Alternative therapies such as acupuncture, massage therapy, and a technique called cupping really are making differences for some patients. Here to tell us more is acupuncturist Kerry Boyle. Welcome, Kerry. Thank you so much.
Thanks for having me.
Of course. So, tell me what acupuncture is, because a lot of folks, I've had it, but some people don't know what it is. What is acupuncture?
Sure. So acupuncture is originally from China. It's been around for thousands of years. And it's based on a system in our body called qi, or energy, that moves through our body and can get stuck. Now, Western medicine wants to know, what is this qi? We can't see it under MRIs or x-rays, so they do their own tests. And what they found out is that when the acupuncture needle goes into the body, there's a relaxation response, an increase of circulation, and the muscles all relax, so we get pain relief.
It's awesome. And you have a needle here. Can you show it and maybe demonstrate on me?
Yeah, I'd be happy to.
Do we have the EMS people standing by?
It shouldn't
In case,
hurt at
excellent.
all.
If there's blood spurting, we've got medics that can clean it up and everything. Perfect. So,
Okay.
and then somebody's going to stand in if I do pass out, but just kidding. It'll be fine. Go
So we've
for
got
it.
stainless steel needle, itty bitty, really small.
Yeah, show that to our folks here.
Sure. So this
Itty
is a
bitty.
small acupuncture needle. It's about the size of a human hair.
Yeah, you can't even see it really.
And we've got a guided insertion tube that'll help it go in painlessly and quickly, just like that.
I was going to say, but really I couldn't feel it, so I missed the timing. Look at this, folks. Isn't that nice? So it's pretty easy. So awesome. So this acupuncture can, I've had employees, I've had patients that have had injuries to all parts of their body, wrist, shoulder. I mean, it can really be a game changer, right?
Absolutely. We treat all kinds of pain.
And prevent sometimes from going on to having replacement or surgical techniques, right?
Yes, by relaxing the muscles and increasing the circulation, we can avoid and prevent surgeries.
And so what you're doing is you're using your own body's system of healing. Your body is very powerful, and I think as time goes on, we're going to go backwards. What I mean is that this stuff has been around for thousands of years. We are discovering it now.
Right.
I think lots of techniques. You've got other techniques that you use in your practice. Tell us about them.
Sure. So we practice all of traditional Chinese medicine, and
Yes.
acupuncture is just one of the tools. We also do Chinese herbalism, nutrition, lifestyle recommendations, massage, and cupping is one of them.
How does cupping work? What do you do with that?
Kind of think of cupping as the opposite of a deep tissue massage, right?
Oh, okay.
Deep tissue pushes down
Yes.
on the muscles. This is going to pull up on the muscles. It's also going to create circulation. So it can help with micro tears in the muscles, and it will just relax the muscles. So the traditional way to do it is to take a flame, extract the oxygen, and then put it right onto the skin. Creates a little suction. And then I might move it around, and that creates more circulation. People find it really relaxing.
And I'm asking the director, can we have a flame? Oh, they're telling me no, it's a violation. Sorry, no flame today.
No flame.
Oh, sorry. But what else do you do?
So we also do Chinese herbalism,
Yeah,
and
what
that's
does
a
that
big
mean?
part of what we do. Actually, today in the green room, we had some herbs with us for back pain.
Awesome.
And we had people put them in their shoe, and it was able to reduce their back pain right away.
Wow.
Yeah, it's the rubber tree called duzhong or euconium, and you put it in your shoe, and it relaxes the muscles of your back.
Isn't that amazing, guys? Wow. And so how quickly can people say, well, is acupuncture going to work in 2 minutes? Is it going to take 3 weeks? It really depends on the individual, but what's your experience on this?
So it depends on what we're treating and the individual. But we do know that after 25 minutes of retention time of the needles, there's actual changes in the brain to relax you, releasing dopamine, serotonin, and endorphins. So even just in that one treatment, people feel really relaxed, have stress relief and anxiety reduction. With the increase of circulation with every insertion of the needle, there should be a reduction in pain immediately. It's just how long is it going to last? That depends on the health of the person and the condition.
And that's why it's not that you just get one treatment and you never see her again. You have to do it, periodically. For some of my patients, they've done it for weeks and months, and so it's a practice. You have to continue to do it. And what kind of feedback? It's got to be very, very fulfilling to get the feedback from your patients. What kind of feedback do you get?
Well, people have major changes in their lifestyle, and they're happier and they're healthier. They sleep better. They get colds less often because with every acupuncture insertion, there's more white blood cells produced. So the immune system is helping with that.
And who really can't have this? We only have about 30 seconds or so. But who's out there that should not get acupuncture?
Gee, that's a tough question. Acupuncture is really helpful for everyone.
Right.
Yeah.
And what I would say to folks is that please ask your doctor, a medical professional. If there's something that, you know, if you're prone to more injuries, or if they're worried about certain therapies. But I have not really met anybody who cannot get acupuncture.
Absolutely.
And the way I would say is it's another tool in the armamentarium, right? So when we talk about medical therapies, you have procedures, you have pills, you have all types of things like diet. This is just another tool in your armamentarium. And sometimes I'm sure you use acupuncture along with cupping. And then diet is so important. You've got to be able to not visit that fast food restaurant, eat cleaner, right? And go to practices that doesn't introduce toxins in your body, because it's not a one-size-fits-all. The problem in Western medicine, I think, is that we expect that you do something, and if it doesn't work, you basically withdraw. But this is something as a part of a practice, so really important stuff. Thank you for coming on and telling us some of the truth, and then not hurting me. See, there's no blood coming out. I don't know if you can see that. No blood.
Good job,
Did you guys?
brave.
Aren't you guys proud of me? Yeah.